Hello, my name is Tessa and I'm going to be your student nurse for today. Could you tell me your name and date of birth?
Maria Gibbons, 11/16/65.
Okay, Maria, do you have any allergies?
Just seasonal allergies.
Okay, and what is your reaction?
Watery, itchy eyes, and sneezing.
Would you say this reaction is more mild, moderate, or severe?
Mild.
Okay, so today I'm going to be doing a lung assessment on you, but since I got all that information, I'm going to go first wash my hands and then we'll get started. Okay, so to start this assessment, I'm going to first locate her radial pulse and I'm going to check her heart rate. So I'm just going to grab her here. First, I'm checking to see if her pulse is regular or irregular, and hers is regular. So for a regular pulse, I'm going to count for 30 seconds and then multiply that by 2. Okay, like I said, her pulse was regular. It was 72 beats per minute and it was a 2+. And while I was doing that, I was also checking her respirations so that she wouldn't change her breathing. And her respirations were 14 respirations per minute. So to begin, I'm just going to ask her a couple questions. I know you already told me your name, but could you tell me where you are?
I'm in my home in Michigan.
Okay, and what is today's date?
July 13th, 2020.
Okay, and do you know why you are here today?
I'm here for a lung assessment.
Okay, good. So my patient is alert and oriented ×4. That is what I was checking for. And now to start the assessment, I'm just going to be looking at my patient as a whole. She appears to be healthy overall. She can sit upright. She has good posture. She is not working too hard to breathe. She looks like she practices good hygiene. Everything like that. So I would say overall she seems pretty healthy. So now looking at her overall work of breathing, since this is a lung assessment, looking at her, I don't see that she is using any accessory muscles to breathe to assist with her breathing. She can sit erect. There's no signs of tripod positioning. She doesn't have any nasal flaring or pursed lip breathing. So I think overall she seems to be breathing fine. She doesn't have any skin discoloration. Her skin is consistent with the rest of her body and her face and her lips. So now I'm going to first start by inspecting and palpating her trachea to see if it is midline. So just by looking at it, it looks to be in midline. But now I'm going to palpate, and if you feel any tenderness, just let me know. Okay, so by inspecting and palpating her trachea, I would say that it is in midline. So now I'm going to be looking kind of at her chest and at her back to see if everything is like symmetrical and in the right position. So just looking at her chest, I would say her chest and her thoracic cage is symmetrical. Her sternum appears to be in midline and straight. Let me see on the back. I'm just going to kind of touch her spine really quick. Her spine appears to be straight. Her scapula and her shoulders are symmetrical. They are at equal horizontal positions. Her scapula are not protruding. And then I'm going to do a quick test to see to test her antero-posterior to transverse ratio. So for that, I'm just going to palpate here. Okay, so her antero-posterior to transverse diameter is a 1:2 ratio. Okay, so now I'm going to start by palpating. So I'm going to palpate her spinous process and then her rib cage. And at any point, if you feel any tenderness or pain, just let me know. So I'm going to start at the cervical spine and go down the cervical, thoracic, and then into the lumbar spine. Just by using a couple of fingers to palpate. Okay, did you feel any tenderness or pain?
No.
Okay, that is good, and I didn't feel any abnormalities or everything kind of felt like it was in place. Now I'm going to do her ribs, so that I'm just going to palpate again. Make sure I don't feel any spacing or anything like that. And did you feel any pain or tenderness there?
No.
Okay, so I would say there was no abnormalities or anything like that. I did not feel anything. So now I'm going to be percussing her lung field. So for that, I'm going to do it on her posterior, on her back. I'm just going to be taking 2 fingers and tapping my finger against her back. And for this, I'm looking for or for different tones. And then I'll go over that after once I hear things. Okay. Like I said, I'm just using 2 fingers to tap my hand. What I'm hearing while I'm percussing is I hear some resonance, which over the normal lung tissue, which is normal, that's bilaterally. And I also heard kind of like a more flat tone over her scapula, which is also normal. No, there was no abnormal sounds or dullness that was evident to me. So now I'm going to start the actual lung assessment where I am auscultating her lungs. So for that, I'm going to be auscultating her lungs anteriorly, laterally, and posteriorly. And I'm going to go kind of in order. I'm going to start from the top and then go down. So while I'm doing that, I'm going to be going from side to side so that I can compare the sounds on both sides. It's just better to do it that way. Okay, so while I do this, I'm gonna do it with the diaphragm of my stethoscope, and I'm just gonna have you take in a deep breath and then let out. So just deep breathing. Okay, so I'm gonna start up here. And then this is where I'm gonna start doing the upper lobes on both sides. And then on the right side, I'm kind of moving into the middle lobe, and then on the left side, it's still the upper lobe. And now I'm kind of moving to the lower lobes on both sides. And to do that, I also have to go measure them laterally. So I'm going to keep moving from side to side. And then I'm going to do them laterally to check the lower lobes. Okay, and now I'm going to be doing the same thing on her posterior, on her back. I'm going to have her take the same deep breath, and I'm going to continue going from side to side so I can compare. Then I'm doing this between her shoulder blades and her spine, so that I can actually hear the sounds and they're not muffled by the bone. Working my way from the top to the bottom, moving side to side to compare. Okay, you can turn back around. So measuring anteriorly, laterally, and posteriorly, I did not hear any abnormal sounds. So what I did hear, her lungs seemed to be clear. There was no wheezing, crackles, rubs, or other adventitious abnormal breath sounds. Her bronchial, bronchovesicular, and vesicular breath sounds were all of normal pitch, volume, sound, and they were normal duration. So I didn't hear any abnormalities in any of the positions that I was doing. So now I'm going to do 3 more tests. I'm going to do these on her posterior. And for these, I'm going to have her say different things. So I'm going to start with, I think it's agophony or agaphony or something like that. So for this one, I'm going to be having her repeat the letter E. So I'm going to have her say E, E, and that's going to be the first one that we do. So I'm going to come back around here so I can show you the back. And I'm just going to be measuring or going over a couple different spots for these. Okay. Can you say E?
E.
Can you draw it like, yeah, like that? Good.
E. 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 E.
Okay, good. So for this one, her voice is soft and muffled. It was normal because I could hear her say the letter E, and if it was abnormal, I would hear her. I would hear the letter A. So this test was good. The next test is bronchophony or bronchophony. So for this one, I'm going to have you repeat the words 99, 99, 99.
Okay. 99, 99, 99, 99, 99, 99.
Okay, for this one, again, it was soft and muffled. It was indistinct, so I could hear like her voice, her saying something, but I could not make out the actual phrase 99, which is normal. You don't want to hear those things. Okay, so lastly, I'm going to do the whispered pectoriloquy, I think it is. So for this one, I'm going to have her actually whisper the phrase 1, 2, 3. And I'm going to be doing the same thing, just measuring. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, so for this, the transmission of sound was muffled and faint, and it was slightly inaudible. So I could kind of hear, kind of not. So for the last actual part of the assessment, I'm going to be checking her chest expansion. So for that, I'm going to be holding my hands like this, and I'm going to place it back here, like kind of by her lungs, with my thumbs like on the both sides of her spine. And then I'm going to do it in the front as well. So for this, I'm just checking to see how much her chest is expanding. Okay, so I'm going to have you take in a deep breath and then let it out. And we'll do it one more time. Okay, and then I'm going to do it on the front as well. I'm going to do it under here. Okay, so her chest expansion was normal. My thumbs, that's what I was checking to see if they would move, and they did move about 6 centimeters apart symmetrically, both on the front and the back. And I just want to point out that all of these assessments I would have done on bare skin, not through the clothes, so that they wouldn't be muffled or I wouldn't hear those extra sounds. And then that actually concludes the assessment for today. Do you have any questions for me at all?
No, thank you.
Okay. Thank you for being my patient. And that concludes the assessment.